dog that spontaneously ruptured its medial collateral ligament while playing in the park, chasing a ball. So if we look at the hock joint here, we can see that we can displace it laterally, meaning that we've got a defect in the integrity of the medial collateral ligament. The other thing we can see is that we've got extensive swelling on the medial collateral ligament, the area over the medial collateral ligament here as well. Now, radiographically, there was some calcification, looked like some avulsion of the collateral ligament from the medial malleolus, and no evidence of extensive degenerative joint disease. And so because of that, rather than doing a pantarsural arthrodesis, we've decided to go ahead and do a repair or replacement of the collateral ligament. If you haven't already done so, please subscribe to our channel. Make sure you turn on notifications so you get a ding on your phone the next time I live stream. So I'm doing a medial approach to the hock here, and just to get you oriented, this is distal down here. Let's see, this is distal, where are we? Down here, and that's proximal. I might try to move my camera a little bit. So that's distal, that's proximal. Just belly up to the bar here, Dylan. So I am going to use fast tack suture anchors to replace the ligament. And one thing that's really critical is when you're replacing the collateral ligament in dogs and cats after traumatic injury is that you have to replace both the short and the long ligaments. If you replace just one or the other, they have an inferior outcome. And that was done by a surgeon, or a retrospective study by a surgeon named Denny Aaron, who was in the University of Georgia back in the late 80s. And he had numerous cases of dogs and cats that had traumatic injuries. Interestingly, most of the injuries were motor vehicle trauma, where the ligament was basically ground down by the pavement. So we've got a big bulb or bulbous area right there where the dog is trying to create fibrous tissue to stabilize its ligament. So again, to get you oriented, the tibia is up here, that's the medial malleolus, and that's the metatarsal, probably the distal tarsal bones, and then into the metatarsal down there. So I'm just going to try to carefully dissect down here, try to remove some of this fibrous tissue so I can see the relevant anatomy. See all that scar tissue there. See that, Matt?
Yep.
Matt secretly wishes that he was a YouTube star.
How do you know, Charles? You're living my dream.
Yeah. Might not even be that secret.
Are you having a dawn stroke in dogs?
Yes. So we really have to spend some time dissecting this out and then establishing our normal anatomy so that we can accurately place particularly our proximal sutures in the center of rotation. So if you misplace your sutures and they're not in the center of rotation, then they're not going to be tight during flexion and extension, and that's the key to success with these guys, is making sure that the sutures are tight throughout the range of motion, or at least one of the sutures is tight throughout the range of motion. So this is all scar tissue here. That's into the joint there. great, thank you. Try the rongeurs here a little bit. Thank you. And Emma, if you see any questions that, and you have time,
Adjust the focus. How can I do that?
you can't. It's fine. It should adjust itself.
Yeah.
So all of this is just scar tissue from, again, the dog attempting to stabilize. So I also want to remove all that scar tissue so that my sutures can be tight up against the side of the joint. I don't think the video's out of focus, but I can try to zoom out. Sometimes that helps. What's that question there, Emma?
Would you please remind us what this case is about?
So this is a middle-aged, older dog that was completely healthy, but then acutely became lame on its left hind leg after chasing a ball for an extended period of time in the park. And it has instability of the medial collateral ligament due to a rupture. You can actually see, in just a second, I'm just removing scar tissue here. So we can see, if we open this up, we can see the talus right there. So that's the talus sitting right there. And that's the medial malleolus. And we've definitely destabilized the hock by removing all of the scar tissue. So we can see that the dog has done actually a reasonable job of stabilizing itself. There's the electrical artery. All right, so medial malleolus is there. That's the talus sitting right there. All right, so can we get some saline flush, please? So you can see the instability there. So this is really breaking open now. You can see right into that hock joint there. All right, so we'll flush that out. And then, Emma, if you get a chance, can I please get that wire right there? Yep, and then I need 2 of these hand pieces.
Sure.
Thank you. So while Matt's flushing that, I'm just getting the rest of our equipment. Getting a little suture passer. See, that's a little loop right there. I don't know if you guys can see that, but that's just basically to pass the suture through the hole that I'm going to create. And this is our fast tack, so we've got a suture anchor at the end there, and then we've got the suture wrapped up around the handle. And just have a look at that. So that's the suture anchor there. All right, So what I'm going to do is I'm going to drill a hole at our insertion. Let me think about this for a second. So that's where our short collateral ligament went, right there. I'm just going to the calcaneus here. Okay, so that's in the calcaneus, and I'll go ahead and drive so I don't lose that hole. So that's solidly in the calcaneus. Let me just make sure that that is. Okay, so that, I'm just going to pull on that really hard. So that's really anchored there. So that's my first suture. Lay that here, and then I'm going to my long collateral ligament. Can I get a needle, please, to just try to differentiate between the distal talus and the central tarsal bone? Okay, so that's the joint there. All right, so this is where I'm going to put my second anchor. Okay, you can move it. Not totally happy with that. Let me just have a better look here. There's our periosteal elevator. This felt a little bit loose. I reckon I'm going to go a little bit farther down into that fifth metatarsal, where I know I'm going to get solid bone.
Is it possible to perform arthrodesis in this case as a second option?
Yeah, so arthrodesis was the other thing that we discussed. The reason I didn't go for arthrodesis was because there wasn't a lot of degenerative joint disease here, and I think that you'll get better function with a good ligament replacement than you will with an arthrodesis, particularly if you have complications. So this is our second suture here. Just make sure these are both very secure. They are. So now I'm going to make a hole from caudal, or from cranial to caudal, in my medial malleolus. Yes?
Blood pressures have been consistently really high. Right heel pushing
Yeah. Thank you. Just give me some counter pressure there. Okay. So now I'm going to use my wire passer.
So yeah.
I'm going to pass one of my long strands and one of my short strands. pull that through and see how that looks. Okay, so that looks great. And then I'll do the opposite here and pass the other of our long strand and the other of our short strand. Pull that through. Hold on to that, please. Okay. And release them from my wire passer. Okay, so now you can see what we've got here. All right, so that looks very secure. Let's just see, pull on those and see what kind of range of motion we get. So that's, let's make them really tight.
A little bit off the frame.
All right, so hold on to that. Problem is that that might restrict my motion a little bit if that's too tight. Let's see what happens with this one here. And we'll use a blade to cut this. You can't really cut it with scissors. Thank you. So now let's see what kind of range of motion we have. It's tight, but that's okay. And we've got good improvement in stability here. So that the long one is going to loosen in flexion intuitively, and the short one is going to tighten in flexion, and then the short one's going to loosen in flexion, and the long one's going to tighten in flexion. So basically we just want to make sure that we have good stability throughout the range of motion, which we do.
Question.
Yeah.
Can we do the same thing by just putting 3 screws in the same fashion and join them with cerclage wire?
Cerclage wire is going to break. So you can definitely do the screw thing, but the cerclage wire is going to break if you use it to replace the ligament. So you really need to use some fiber wire or something like that. All right, so let's flush. can we get some 2O PDS, please? All right, so I'm going to try to get some fibrous tissue to cover that knot or those knots. Thank you. And it's possible that we'll have to remove this suture, but as long as it's in for about 3 months, that'll be plenty of time for it to provide stability.
And what's the recovery time?
So about 12 weeks recovery time. So restricted activity, meaning leash walking only, a couple of times a day. The other thing is that we'll put a soft padded bandage on this as well.
Is this a fiber tape material from Arthrex?
It is exactly what it is. Yeah, fiber tape on a fast tack. And as far as suture anchors are concerned, I've never seen anything that's easier to apply than these fast tacks. Problem with using screws is that sometimes the suture will slip over the head of the screw. It can help if you use washer. And so the way we used to fix these was just with screws, washers, and Prolene suture. But Prolene, if you've ever used it, is really stretchy. And so I'm not sure that we were providing a huge amount of stability, whereas with the fiber wire, that is some very strong stuff. I think it's about 500-pound test on each strand, and we've got 4 strands here. So there have been a lot of ways described to repair this type of thing. The other thing you can do is just drill holes in the bone and then pass the suture from medial to lateral and then tie the knot laterally. I invented and patented a device which is an articulated external fixator that you have 1 pin that goes in the center of rotation of the talus and 2 pins in the distal tibia, and so you continue to get range of motion around that central pin, but it provides absolute collateral ligament stability. And I've probably done about 40 cases like that, and it worked really well. So I have to probably try to 3D print some more of those, because the original batch that I had made for me by injection molding has run out. I originally had invented it as a way to manage cruciate ligament disease, where you wouldn't put any kind of implant. You would just stabilize the joint for 3 months, and then fibrous tissue would do its job. But I found that because the stifle internally rotates as it runs through a range of motion, having something that's a fixed hinge was not really appropriate. Whereas for the hock joint, which does not internally rotate, it is basically a hinge joint, it was much more appropriate. So that actually worked really well. I never published it. And I don't even know how we would find those cases. I did a lot of them when I was in America. I saw Matt's eyes perk up, or ears perk up. I thought, oh, a paper.
Need to get those credentials.
Yeah. All of our interns and residents are hungry for publications.
What weight of dog would fast tack be useful for?
So this dog is probably about 35 kilos, I would imagine. How much does it weigh?
25.
25. So the large fast tack would probably be fine up to like a 40 kilo dog. And if you had a bigger dog, you could just add more strands. And then we've got smaller fast tack that you could use in smaller dogs and cats. And I can't tell you how much they cost. I would imagine about $250 each, if I had to guess. And I'm sure that there are aftermarket copycats that you can get on Alibaba, or I'm not sure if eBay, but one of the medical supply companies that's based in either China or in India. You can get all kinds of stuff like that for a lot cheaper and similar quality. All right, so can you do some cruciate sutures?
Yep.
In the skin, you can just use that same suture.
Okay.
All right, so I'm just going to come over and have a look at, hey?
River line?
Yes.
All right, so I'll just go back to the beginning. Hello from Korea, Japan, Dubai, Romania, Mexico, Portland, Oregon, California, Brazil, California, Boston, Boise, Idaho, and that's pretty much it. So I'm going to go ahead and wrap that up. Thank you very much for watching. If you haven't already done so, please subscribe to our channel. Make sure you turn on notifications, and we will see you next week.